the kind of stress, the kind of anxiety, how do you work around it?
Actually, we have to have the determination that we are actually choosing the correct path, then we have to walk through it.
There are questions in AMC which have options which are very close. Did you have any strategy to address those questions?
If I'm facing two almost quite similar answer or options, I would start to use the elimination method. And I want to thank Academy and the team as well, especially a special thank to Madam Bharti because being a good coordinator and always reminding us for all the lectures, especially when there is some change the timing.
Good afternoon, everyone. I'm Dr. Snigdha Sharma, Academic Head Medical Courses from Academically. And today with us, we have Dr. Lim, who has recently qualified AMC Exam. So congratulations, Dr. Lim.
Thank you.
It is a very common question that how are you feeling? And I have already asked you. So without taking much time, please let our learners know, how is that feeling? How was the moment when you saw the screen saying pass?
Yeah, I'm extremely happy and excited. Yeah, actually, I'm feeling grateful that I passed in my second attempt, which is about 3 months apart from my first one. Yeah. So,
Dr. Lim, giving an exam the second time, especially 3 months apart, the kind of stress, the kind of anxiety, how do you work around it to control it and make sure that you're on the right path, you're revising properly, you're looking at your materials properly and not losing the sight of the goal and not getting discouraged? How did you do that?
First is actually we have to have the determination that we are actually choosing the correct path, then we have to walk through it. So after I get to know that actually I failed my first attempt in the July of 2025, but still I keep motivated myself that I can get through it. So immediately I made up my mind to sign up again for the second attempt in October, which is actually 3 months apart. So eventually, I still keep it with Academically and still do it, revise all the lecture notes, attend all the online lectures, and also revise again all the partial questions, especially the higher questions. And not just merely remembering all the questions and the answer, but actually I re-emphasize back what are topics that I'm actually lacking of. And so I made an assessment from that. And from there, actually, eventually I made it. Yeah.
Okay.
And I see there's a huge or a significant improvement in terms of mark compared to my first attempt, which actually made me very happy. Yeah.
Okay, that is a great thing to hear. So, but now that you have attempted the exam choice, can you say that AMC is kind of shifting its pattern that we have lately heard from a lot of students?
Yeah, I would say yes, because previously, as we know that usually all those people, the previous attempt or candidates, they will say that at least there's 50% of the partial question inside. But from the 2 attempts that I have went through, I didn't really see that there's much of the question in there. If there is, it's usually less than 10 questions out of those 150 questions.
Okay. And are the question stems longer compared to the first attempt that you had given in July?
Say it's almost similar in some of the question types.
Okay, so not that much. And is the difficulty level what you were told by your seniors, has it changed a bit or is it still the same?
In terms of difficulty, I would say compared to the July attempt, maybe it's partly because I'm not familiar with the pattern of the questions. Okay. So in terms of the difficulty, I would say it's almost similar, but maybe it's a little bit more in the July. In October one is better or acceptable for me.
Okay, that's why I think a lot of people prefer to give the exam in October and November. Okay, so this one question that is very commonly asked, and I would love to ask you as well, why AMC and why Academically?
Okay, first actually I got to know Academy through Facebook, if I'm not mistaken. And then I signed up in November 2024.
Oh,
Yeah, so from there actually it's almost a year from now. But I really thank Academy because being helpful in providing all the learning materials, and not just that, but also the online lectures, and also all the partial questions, including the high yields question, and also not to forget the ebooks, including the Geomata, and then the Kaplan, the Red Book, the Blue Book, yeah, all that. I make sure I revise at least twice.
oh. So that is something like everyone, you have done it multiple times, right? Well, that's just great to hear. So one thing, there are questions in AMC which have options which are very close. Usually that's where the students are making mistakes. Did you have any strategy to address those questions?
Usually, I will, if I'm facing two almost quite similar answer or options, I would start to use the elimination method
Okay.
and to see which one to be emphasized on, and then back to the question asked, especially the keyword, for example, the initial, the most appropriate, to help us to eliminate or choose the most appropriate answers.
Okay. Okay. So I think, guys, anyone who's listening to this interview, you have to start using those strategies, because we have had a lot of students lately who are missing the exam just by few marks. And what I have personally felt is these questions make a difference for them for the crossing line. And it's a great advice from your end. So, what would you tell people who are working and studying along with how to plan a strategy?
Yeah, actually, I'm one of them.
Yes, that's
Yeah, actually, I'm working and at the same time, I'm preparing for MC as well. So actually, the time distribution is very important.
yes.
Yeah. So especially when you're towards, you have to set your time for the MC exam ready. So make sure at least 2 or 3 months before that, you do more intensive revision, especially those past years. But not just merely remembering the answer and the question, but you have to actually find out what topic you are lacking of. So there you have to dive deeper and get to know what you need to improve. Especially, you need to get more familiar with how to diagnose it and how to manage it, and in line with the latest RSCPG as well. Yeah, that will help you.
Yes. So, guys, you have to learn how to balance and how to limit your resources, like Dr. Lim suggested. You need to know what to do and how to reduce your work. And definitely, would you recommend the freshers who are getting out to work and study along, or just to sit and study? What would be your recommendation, Dr. Lim?
I think it's okay as long as you're able to cope it. It should be okay.
But then, because you are also a working professional, did you take the last month off? And like, it's usually recommended to sit 12 hours a day.
So-called the study week. Yeah. So actually, I did almost like 2 weeks prior off totally,
Okay.
not for work. Yeah. So I really focus on my study only.
So that is necessary, right, for everyone to do that. So guys, 12 hours, you have to just sit at least 2 weeks minimum. That's what you have to get, right?
Yes.
That is a great insight into the strategy. Thank you, Dr. Lim, for connecting with us. And that is a great insight for the students, especially we have a lot of students taking the exam in November. And I hope, like, we are almost bucking up to this last exam session of the year 2025 in November. I hope they listen to the interview and gain some insight on how to go ahead about it. Thank you so much, Dr. Lim, and congratulations once again.
Thank you. And I want to thank Academy and the team as well, especially a special thank to Madam Bharti, because being a good coordinator and always reminding us for all the lectures, especially when there is some change in the timing, and also always giving us motivation prior to exams.
She would be happy to hear how grateful you are with her.
Yeah, and also not to forget all the doctors as well, because for their lectures, for their knowledge, and also their tips on the AMC exam.